I am Allison Fraser from Pathfinder Health, and I'm speaking today with Dr. Paul Patterson, our developmental and behavioral pediatrician. Hi, Paul.
Hi, good morning. How are you, Allison?
I'm great, thanks. Today, we'll be discussing Paul's article, When Should You Be Concerned About Your Child Development? And obviously, this is a really important topic. As parents, we all want to know whether our children are developing as expected and if there's anything that we can do to help their progress. So to start off, can you tell us how we measure child development?
Sure. Over the years, through studies, we've learned that children develop in a relatively set pattern, meaning most children, obviously roll over before they sit up and they sit up before they walk. So we know that there's this set pattern of development that is followed. Now, the timing of that development is very much dependent on the child and various factors. And so there's a range of time in which that development and reaching those different tasks in the sequence that we expect is appropriate. And so we measure child development using things like milestones. And a milestone is a particular task we expect the child to achieve within a specific time range. And so, for example, sitting independently would be an example of a milestone. And we would expect the child to be able to sit independently at a particular age. So around 9 months of age would be the upper limit of when we would expect a child to be able to do that. So that's an example of a milestone. And there are literally hundreds of milestones that we use to track child development. We also use screening tools to track child development. And screening tools are formal assessments of a child's development based on parent report, and usually ask about those milestones. So you've probably filled one of these out as a parent before, and it'll say, when did your child first roll over? Or is your child rolling over right now? It might say, when did your child first sit up? Or is your child able to sit up independently, for example? And so as a parent, you might answer those before one of your child's doctor's appointments with their pediatrician or general practitioner. And those screening tools allow us to get a glimpse of, is a child meeting the milestones and meeting those developmental tasks at the age that we would expect them to do so. So it's really multifactorial. And how do we do this? Like I said, we use milestones, and screening tools are the predominant way we do this. And it's often done in conjunction with your physician.
And can you tell us about some signs that parents should be aware of that might indicate a developmental concern?
Sure. If you're looking at the milestones that your child should be achieving in the age range that they should be achieving them, and you notice that maybe your child is not doing so, it would certainly be appropriate to have a discussion with your child's doctor about that. And of course, if you are comparing your child to other children around them at the playground or at daycare, nurseries, parent groups, play groups, things like that, we don't recommend that you necessarily compare your child to every child around them. But if you as a parent are like, my child just seems to be developing different than a lot of the other children that I've observed around the same age, and you have a concern, again, it's totally appropriate to bring that up with your child's physician as soon as you can. But moreover, like, you can download lists of these milestones through the app, and then be reassured by looking at them and understanding the time frame in which they should occur for your child. And again, every child's different. So when a child reaches these milestones, there's certainly a range of what's normal. Some children might do something at 2 months of age, and that might be a little early. A child might do something at 3 months of age that might be more appropriate in the time we would expect them to. And some children might not do a task until 5 months of age. So I can give you an example. So rolling over, we expect the child to begin rolling over around 4 months of age. And I say around 4 months of age because some children will do it as early as 3 months of age. Some children will do it at 4 months of age. And some children won't do it until 5 months of age. That's all within the normal limit. And so again, we expect the child to progress and hit certain milestones in a set pattern, but the timing of those certainly varies a little bit, and there's a range for each child. And children don't always develop exactly the same in every domain of development. So there are, motor skills, there are language skills, cognitive skills, and social skills. And so some children might develop a motor skill a little bit on the earlier side than their peers would. And at the same time, they might develop a language skill a little bit later in the course than maybe one of their peers does. Again, that's all within the range of normal and not necessarily something to be concerned about, but we want to understand that every child's a unique individual and has a unique developmental profile.
So if there's a range of normal, at what point do we consider a later development of a milestone to be a developmental delay?
That's a great question. And it really depends on, what kind of screening we're doing and what we're looking for. There are certain milestones that if you don't achieve them by a particular age, we consider that a red flag or a definite warning sign. A very classic one would be walking. And walking has a very broad timeline. So that's a very specific milestone. We say, does your child walk independently? But the timing for which that can occur is pretty broad. Most parents would think that their child should walk, around 12 months of age. A lot of children walk 13, 14, 15 months of age. Some walk at 11 months of age. So it's a very broad window of time when we would expect the child to take independent steps on their own and walk independently. But there is a point in which that becomes, too late, and we are concerned that there could be a developmental delay. And for the case of walking, we would say if a child's not walking by 18 months of age, that's definitely an example of somebody we would want to evaluate and have seen by their pediatrician, because that would be considered outside the range of typical development. And each milestone has different limits. So for instance, I mentioned rolling earlier. That has, like a 2-month window we would expect to be normal. Whereas walking, as I just talked about, has a much broader window of almost, 6 months range or greater that could be considered normal. So it depends on the milestone. So there's no one size fits all or one single answer of when to be concerned. And that's why we use milestones and screening tools such as the SWIC to look at a child's development and determine, is it within this range that we consider typical development, or is it kind of outside that range where we wanted to investigate a little bit further? And just because a child doesn't meet a milestone and we suggest investigating it further doesn't necessarily mean there's a problem either. It just means that we would expect them to do that by that age, and perhaps your child's just following their own developmental timeline and we'll catch up. But we don't want to miss a developmental delay or something that could be causing a developmental delay. And that's why when you're outside the time range or time frame that we expect you to achieve a milestone, further investigation is kind of warranted with your pediatrician.
That makes sense. So you mentioned some movement delays. Can you tell us a little bit about some other types of delays that a child might have?
Sure. And so when we think of the broad categories of developmental domains, we think of movement and language, cognitive, and then social emotional. So 4 broad categories or developmental streams for your child. And a delay just means that a child is not meeting a milestone in the time frame we would expect them to. It doesn't mean they're not meeting. They may be moving through a sequence that we would expect them to. Doing one milestone before another, such as rolling over before sitting, but maybe they're not meeting those 2 particular milestones in the time frame we would expect them to. So that would be an example of a delay. The same can happen with language delays. We would expect the child to be babbling, at a certain age, and if they don't, we would say that's a delay. Social emotional, for example, we would expect the child to have a social smile at a particular age, and we might expect the child to start sharing with others at a certain age, or pointing to show things to a parent at a certain age. And when a child doesn't do that, we say, well, there's concern for a delay in that particular area as well. So there could be, social emotional delays, language delays, cognitive delays, and motor delays. A delay just means a child's not meeting the milestone in the time frame we expect them to. And we would expect with intervention, then the child would be able to catch up. And that's why we just call it a delay.
So if a parent is concerned that their child might have a delay, what should be the steps that they take?
Well, anytime you have a concern about a delay, it's certainly appropriate to raise that concern with someone. And the best person to raise that with would be your child's doctor. There is also early intervention services in the United States, where any child under the age of 3 years of age, a parent can self-refer to their local early intervention service if they have a developmental concern about their child. And the team from the early intervention office will evaluate the child and determine if there is truly a delay that needs intervention. So either way, certainly always appropriate to bring it up with the pediatrician, and at the same time, you can engage with your early intervention office if you truly have a concern about delay.
And it's important that parents do this as early as possible, right? Can you tell us about the reasons why that's really important?
Sure. So in a young child under the age of 3, the brain is developing rapidly. And up through age 5, almost 85 to 90% of our brain's development occurs. And so during that time frame when the brain is developing rapidly, we know from research and studies that have been done that if a child has a delay and we intervene and give intervention, that the outcome is much better, and children have a much better potential to reach their maximum developmental potential with that early intervention. So for example, if a child's not rolling over when we would expect them to, we might recommend that they get physical therapy to help with that. And the earlier we do that, and the earlier we identify that delay, and the earlier we get therapeutic interventions, the more likely it is that that child will be able to catch up and then maintain a typical developmental trajectory.
And finally, can you just tell us how Pathfinder is working to help parents through this process?
Sure. So at Pathfinder, we are putting all of this information literally in the palm of your hand through the Pathfinder app. And in the Pathfinder app, we present the milestones within the time range we would expect your child to achieve them. And you can check those milestones off within the app and say whether or not your child's doing it. If your child's not doing it, we can make some suggestions and tips and activities to help encourage your child's healthy development. And if the concern is identified either through the milestones in the Pathfinder app or the screening tools that we offer in the Pathfinder app, we would recommend going to see your physician. But when you go to see your physician or your child's doctor, having used the Pathfinder app, you'll be able to go to your doctor with that information of like why we have a concern, why you have a concern, and actually present some objective information. Say, my child's not doing this task and I would expect them to have done it by now, and that's why I'm raising this as a concern. So Pathfinder is really empowering you with data to know where your child is developmentally, and when there's a concern, we're giving you the information, the data to take to your provider.
Okay, great. This has been so interesting. Thank you so much, Paul.
Of course. Thanks, Allison.